Good evening. I'm David Heath. I'm a non-executive director on the governing body of Somerset Clinical Commissioning Group. Welcome to what is a live virtual event to share the feedback over the recent public consultation which took place about the proposals to move adult mental health beds from St Andrew's Ward in Wells to Yeovil. We want to share with you what people said in response to the public consultation, and that's important because the governing body, when it comes to take its decision, wants to make sure that it's hearing what people say so that we can reflect as far as possible and respond to the needs and views of the people of Somerset. It's a virtual event because, of course, we are still operating under restrictions, which means that we can't hold what we would normally have done, which was a live event in Wells Town Hall. It also means that inevitably at some point the technology may cause us problems, so apologies in advance if that is the case. I'll shortly hand over to Dr. Peter Bagshaw, who's a GP. He's clinical lead for mental health, autism and learning disability services, and to Andrew Keefe, who's the Deputy Director for Mental Health, Autism and Learning Disability Commissioning. And they'll present the independent analysis of the consultation feedback, and they'll also take you through the next steps in the process. There is an opportunity to feed in your comments on the process and to ask any questions as we go. As it's a MS Teams live event, you won't be able to speak directly to me or to our presenters, but there's a Q&A function. So if you click on the Q&A function, you'll be see how to do it, what you can put in, and then any questions or comments that are posted on that will go to our moderator for collation. And after the presentation, I will share with you a summary of those questions and comments, or everything that we've received during the event. And if we can give you clarification and answers, we'll do so. So that's the way the operation will work, we hope. And I'll move swiftly on to invite Peter to take us through the first part of the presentation.
Well, thank you, David. It's actually Andrew Keefe who will be starting, and then Peter will pick up with the participant report feedback. And just to summarise why we're here and what the purpose was, is we did have the public consultation between January and April earlier this year, and the consultation was delivered primarily through a survey for which we got 538 responses, and we held 63 consultation events with 732 participants. What we also found then is because of COVID, we had to reduce the consultation in the end to only have email, telephone and social media feedback for the last 2 weeks of the consultation itself. So the consultation did continue right till the due date of its end on Easter Sunday, April the 12th. And all that feedback from the telephone, from letters, from public events, from groups, was all collected by an organisation called Participate. They were an independent organisation. They pulled together all the feedback and put it together in a return. As I already mentioned, COVID did get in the way towards the end, so some of the face-to-face events didn't go ahead, but we continued to receive the feedback and the survey. What we actually did discuss within the consultation itself was a significant number of changes that we wanted to make to mental health services across the whole of Somerset and across all of the services. So though tonight and for the duration of the consultation, much of the conversation was around inpatient beds, and specifically the beds in Wells and Yeovil, they need to be seen in the context of a much bigger mental health agenda. And this was one of the graphics that was in the public consultation and was presented. And what this essentially shows is there's a whole range of different services, from offer zero of public health and general well-being of the general population, through from that public health prevention and then health promotion, earlier intervention, and then specialist services, moving up the various different levels or offers, if you like, of service. And we're talking about expanding significantly all of the community services across Somerset in primary care, in secondary care, and specifically within crisis service and home treatment services, to keep people and enhance the community services. But nevertheless, offer number 5 is the bit that is around the inpatient, the urgent care services, and that's the main focus for the consultation and this evening, because that was actually related to the inpatient beds for adults of working age. And for a long time there'd been a view held by clinicians and people who worked within the services that the services as they were currently configured weren't appropriate or weren't optimal. And there was a number of reasons for that, but the key reasons was that there are 2 wards, there's Rowan Ward in Yeovil and St Andrews Ward in Wells, that are standalone. And the particular concern was some of the issues that surrounded the support for people in St Andrews in Wells. And the 3 main areas, though there was a number of the 3 main areas, is there's a lack of support from St Andrews as a standalone ward. If ever there's an incident or there's ever any problems on the ward itself, most psychiatric units across the whole nation are co-located with other units, so staff can come and support people and support staff and individuals if there's an incident, or those other people on the ward who may need support during an incident. So there isn't that opportunity. There's also the distance from Wells to the nearest district general hospital. Clearly the nearest one would be the RUH in Bath. That's about 45 minutes even with a blue flashing light, and given some of the complex needs and the incidents that sometimes may occur on an adult acute ward, particularly increasingly there's people with physical healthcare needs as well as mental health care needs, that was felt for some people to be too far a distance. And then also because it's a standalone ward on its own, it has limited medical cover. So out of hours, there isn't a doctor on site. Monday to Friday 9 till 5 there are doctors, but over weekends, evenings and particularly bank holiday weekends, there's long periods of time where there isn't the medical cover that we would like on that site. So just as a summary, these are the 2 wards that we were talking about. The top there is the entrance to the Rowan Ward on the Summerland site, and the bottom photograph is St Andrews wards, and that's the breakdown of the wards. I think it's important to say that with the proposals that were put forward, there will be no reduction in the overall numbers of beds. Instead of having an 18-bedded ward and a 14-bedded ward, we would end up with 2 16-bedded wards, was where the proposals were putting forward. We went through a whole range of options and consulted various different people, including the public, service users, carers, social care colleagues, health and the council and the CCG, as well as the trust. And it was distilled into 3 different options that we could do because of the isolation. If we look at the slides here, you can see Rowan Ward over in Yeovil is close to a district general hospital, and Ryden Wards 1 and 2 are both near Musgrove Hospital in Taunton. So we could keep them exactly the same, and that would require St Andrews to have a refurbishment, but we could keep them the same. Or we could relocate St Andrews Ward in Wells to Yeovil, or alternatively for option 3, we could relocate Yeovil Ward, Rowan Ward in Yeovil, and relocate that to Wells. Those views were tested via an options appraisal, a multi-agency options appraisal, and what came out of that was option 2 was the preferred option. That was a multi-agency group that looked at those 3 options, and so it was option 2 that was brought forward to the public consultation as saying this is our preferred option. There are 2 other options that could be considered, and we would also welcome any other views if there's any other options that people think could be put forward. But as we say, option 2 was the preferred option, and that would result in no overall bed reduction, but it would result in a relocation of the St Andrews ward, those 14 beds, across to Yeovil. So that was the end of the process of the consultation. What Peter is now going to do, I'll hand over, and he will give the independent findings of the report on the consultation and what the feedback was.
Thank you, Andrew, and thank you to all the others in the team who prepared tonight, and thank you too for those of you who tuned in to watch. Really grateful for you being involved in this. What follows, I'm afraid, is a rather dry presentation, and I apologise for that. So it's purely about presenting the participate group's findings. It's not about discussing the rights and wrongs, but we welcome in the Q&As your view on whether the participate analysis is reasonable, and also whether what we put together tonight is a reasonable summary of it, because it will be going to the governing board for their decision. This presentation will be available on the website to all of those attending, and the full report is available, as you can see, on Fit for My Future. So the summary, as one would expect, a lot of people felt very strongly in different directions. Overall, those who were in favour of the proposed change were 37%, and those opposed were 52%. Now, when you do any sort of consultation, those most involved are most likely to respond, and that's what we saw here with the highest response rate in the localities closest to wells. So to put that in context, those three localities represent around a fifth, just over a fifth of the Somerset population, but produced 44% of the responses. The remaining localities were around 4/5, but only produced 56% of the responses. In the three localities closest to wells, the proposals were strongly opposed. So 3/4 of those surveyed disagreed with the proposal to relocate, and only 16% agreed to them. In the other localities, there's a different view, with 54% in favour and 33% against. And this map shows visually that split, hopefully fairly clear to everybody. For those of you who can't read, darker coloured greater, so very dark is 75% and greater, white is less than 15%, agreeing with the proposal to move. The main reasons for opposition. So people who opposed the proposal cited several reasons for that. One was the rural geography, meaning that there'd be an increased travel time for residents to go to Yeovil, associated with the travel cost and the lack of good public transport. Because of this, it was suggested that there would be additional stress to patients and carers, and that could have an adverse effect on the patient's recovery. Some people also felt that the travel could deter staff from moving to the St Andrews ward, and that drew concerns about experienced and valued staff being lost to the service. It was also felt that the proposals would result in a general downgrading of mental health service provision in the Wells area. For example, concerns were expressed concerning the future of daycare. A petition in opposition to the proposal was organised by the Somerset Constituency Labour Party, and that had 382 signatures. This stated that the small number of patients who needed to be referred to A&E didn't outweigh the concerns about the loss of the ward in St Andrews, and cited the difficulty patients and families would have travelling to the relocated sites. It questioned the need to relocate services to Yeovil, suggesting that all Wells residents have to travel to access emergency care anyway. Of the people who supported the proposal, the main reasons were given that they felt that there would be a service improvement for patients and staff, that they agreed that the risk was too great, keeping things as they were, and they felt that there was a need to offer 24/7 medical cover. In addition, it's interesting to note that NHS staff, clinicians and other stakeholders tended to be in favour of reconfiguring the services. Some responses emphasised the development of community mental health services, and this implies a support of the proposed changes. And Andrew has already spoken about this, and it's something we're very proud of in Somerset, where we're a trailblazer project that are really pioneering community health support. Some people said that better support for people with learning disabilities would be easier across two sites. And the Somerset Constituency Labour Party petition stated a preference to retain the St Andrews ward at Wells, increasing funding for safer staffing levels and investing in additional capacity at Yeovil. Part or fully subsidised travel and parking was also suggested. Suggestions for amending or enhancing the proposal. So it was noted that St Andrew's Ward is a familiar setting. It had a friendly family atmosphere, and that in that context it's easier for people to step down or be discharged. Some suggested retaining the ward as a crisis cafe or step down service. There are also some suggestions including enhanced privacy by having male and female wards. So looking through the important equality impacts cited in the Participate report, a number of things were noted. So it was felt that carers might experience added stress and anxiety because of the transport difficulties previously alluded to. There was concern that there might be a detrimental effect on the health of carers, adding to the NHS workload. And the consideration that many carers have other commitments that would mean that they couldn't provide as much support if they had to visit somebody in Yeovil. Some felt that the needs of carers had been overlooked in considering these proposals. Transport costs, particularly for those in low-income households, and the costs of parking or taxes for those on limited income should also be considered. And there was a view that the cost of this travel should be refunded. Looking at gender issues, it was suggested that the two wards should be split by gender for privacy. And one group stated that the LGBTQ+ suicide rates are high, so that group needs extra support. There are also concerns about accessibility because of communication for those who struggle with reading, and felt that there should be suitable forms of communication for certain communities, hard to reach groups, perhaps where English is not their first language, and also clarification about how homeless people would access the service. It was agreed that there should be consideration for those with learning disabilities and autism. St Andrews is currently used as a day centre for dementia patients, and there are concerns that the loss of this could adversely affect that group. And there was a suggestion that a disability transport service should be provided free. In terms of age, it was felt that it was needed to identify mental health issues earlier so that GPs and schools require additional training. And again, this is something being addressed in the new Trailblazer pilot. Issues were raised about transition from child to adult mental health services. Transport for older people was something that felt should be looked at, and an acknowledgement that particularly for this group, public transport can be difficult. And then looking through the survey reports in more detail, again, I think that the important thing here is to look at whether the demographics mean that this represents a fair slice of the Somerset population. So when people were asked in what capacity they were responding, as you can see, most were members of the public, but 1 in 5 were current or former mental health service users. By age, you can see that that pretty much reflects the overall Somerset demographic. And by gender, that was interesting. So you can see that 71% were female, with only 20% male. So that doesn't reflect the overall demographic. And in terms of disabilities, there's slightly higher people whose daily activities were limited. Religion and belief, that looks to roughly represent the overall Somerset demographic. Likewise with ethnicity, though it's worth mentioning that black and ethnic minorities tend to represent a higher proportion of mental health patients. And sexual orientation, again, that looks to be roughly in line with the overall demographic in Somerset. Now this alludes to what was said earlier, where there was a much higher response rate from Wells and the surrounding areas, as one would suggest, because it affects that group more directly. And the risk question, this is a very interesting one. So as you can see, there's a big split here. So overall, roughly 40% agreed that the risk of staying the same is too great, with 47% disagreeing with that. And as you can see, there's a split with both strong agreement right the way across the spectrum. So people had strong feelings, which is to be expected and is welcome. And again, this comes back to the point that's been made before, where those closest to Wells were most likely to disagree that the risk was too great. And again, you can see that there's a little bit of a difference in terms of NHS staff and others, that the feeling amongst over 2/3 of NHS staff was that the current risk was too high. Travel and transport is a very important issue, and not surprisingly, 60% thought that it would be an issue travelling to Yeovil from Wells. Only a quarter felt that it wouldn't be an issue. And then again, you can see that there's a split in terms of where people are, so that those around Wells, the feeling that there was an issue was much higher, so 85%. And again, you can see that split where the people least concerned about that were NHS staff and clinicians, with carers and family members understandably being the most concerned. And overall, you can see that 2/3 of service users felt that it would be an issue travelling. So, of the group findings, and I'm really grateful to those of you who turned out on what always seem to be cold and wet days, often with just a few people there, but I'm really grateful to those of you who made the effort. So as Andrew has said, we had 63 events, 732 individuals, and we tried to get as wide a diverse opinion as possible by going to people in their local areas, not just doing the easy things. So these were the things raised at those meetings and drop-in sessions. A lot was wanting clarification. The transport issues, as you can see, came second on the list, understandably. And then other issues, all very valid, were raised. The one I will pick up is the third sector involvement, where again the Trailblazer pilot actually makes a lot of use of the voluntary sector and has been very successful, as anyone who's accessed the 24/7 GP Somerset Mind Line will know. So just summarising that, as we've said before, transport issues were the main thing, especially for carers and also staff members. So I'll just give you a minute to read through that. And again, we covered this really in the slides, concerns about the services being downgraded. And there was a suggestion that it might be easier to go to Bath. And funding was raised, including a view that maybe assets would be sold off. And there's a question about capacity. As Andrew has already said, there's no reduction in bed numbers. overall sections are generally rising by about 2% a year overall. So obviously that's something that will be kept under review. So the community mental health team, there are concerns raised about their future involvement. And again, the feeling that earlier intervention is better, which is something I think everybody agrees with, as the next comment, a need for a multi-agent holistic approach. I think that will be broadly supported by everyone. And the personal stories were often extremely powerful. Those of you who attended the Wells meeting will know that people feel very passionately and often have very powerful stories to tell, and that's helped to inform the narrative, and we're very grateful for people sharing those. Other issues, children were highlighted as a potential weakness in the model, which I think is widely understood, with early intervention suggested, and hopefully there'll be some announcements on that in the near future, Andrew. And some suggested retaining the ward as a crisis cafe or step down service. So thank you for listening.
So back to you now, David.
Well, thank you, Peter. Thank you, Andrew. That's great. Now getting an echo, which is very disconcerting to me, but possibly isn't for anybody else. First of all, I want to say that I think that this was a very good consultation exercise. We had a lot of response, and it was very good response. It was very well founded concerns which people were putting forward. We did manage to conclude the formal consultation as we planned on Sunday the 12th of April, but we had to change our approach a little bit because of the public health advice, because of the pandemic. Participate, who did, as we've heard, the analysis, looked at all the feedback, did an independent analysis of that feedback. That was completed again on time on the 25th of May. And what happens to that feedback now is that it's directly informing the development of our decision-making business case, and that's what will go forward eventually to help us make a final decision. It'll review each of the key issues raised in the response in the participate report and the consultation. It will include a discussion and evidence and a conclusion and response to the report's findings. So what happens then is that we will have to take a decision, and I say we, that is the governing body of the CCG, my colleagues. We will have to make a decision about improving or changing our services, and we need to be confident that that's properly informed by public opinion. And that's why we go through this process. We can't always guarantee that we're going to agree with every proposal that's put forward, but it's important that we hear the views, we include them in our decision making, and we weigh the views that we hear in the consultation against the other factors that we have to take into account, including government guidance, legislation, what our clinicians, the doctors are telling us, the risks. Finance, yes, but it's not the overwhelming reason in this instance. The needs of different communities and populations, the environmental impact, and staffing sustainability. All these are things that we now need to consider carefully as we move forward. So we almost certainly will get, as we have done in this instance, not one single opinion or view from the public, but a range. And so each member of the governing body, myself and my colleagues, we will have to make our own judgment about how to weigh each of those views expressed. We have to look not just at the present population, but future generations as well, who are probably most affected by any change of service. And we have to look ahead and see how we arrange our services to best provide the best possible healthcare in the future. So What I'm really saying is that the consultation doesn't replace the role of the governing body in decision making, but it does mean, I hope, that we will have good and responsible decision making, and that it reflects and responds to the needs and views of the people of Somerset. And by the people of Somerset, we mean the whole of Somerset. So that is people across the county, but also, of course, people in this instance, the Wells area. As someone from Mendip myself, I'm very keen to make sure that we hear their views and we actually reflect on the consequences that there may be for people in that area. So let's go on to the next steps. On the 9th of September, the Participate report will be presented to the Somerset Health Overview and Scrutiny Committee, and their feedback will then be incorporated into what I've already described, the decision-making business case. That case will then be considered by the Somerset Clinical Commissioning Group's governing body on the 24th of September, and that's where the final decision on the future configuration of adult acute inpatient mental health beds will be taken. At the moment, we're having to hold those meetings virtually in line with national guidance, but any member of the public is able to attend online and listen to the discussion, and in advance, and there is a procedure which you'll see on the website for doing this, raise any questions on the public questions agenda. And if you do ask a question, then please make sure you get it in on time so that it can be included on the agenda. The papers for the governing body meeting are posted on our website, and that's a week before the scheduled meeting. And you'll see on the screen at the moment the website address for that. And we will also publish the final decision on our website, on the fitformyfuture.org.uk website, and we'll share that decision widely. So that's where we are at the moment. We've had one or two questions, so let me see if I can just look down through those. We had one from David Moody. He says, COVID-19 shown that travel can be very difficult and risky for a patient's health. As this was a recurring theme in the consultation, will this be something you'll consider in your final decision, on top of the issues already made clear regarding the difficulties that travelling to Yeovil will cause patients and their family? And of course, yes, all the key themes identified in the consultation feedback is directly informing what, first of all, the decision-making business case, but a dedicated section of that case will review each key issue raised in the response to the consultation, include a discussion and evidence, and identify the conclusion and response. So that's the sort of thing that we will be taking into account as members of the governing body when we finally see that. I have another point here from the Wells City Practice Patient Participation Group, and the PPGs, as we call them, very key parts for, as far as the commissioning group is concerned, is how we interact, how we engage with patients across the county. So we're grateful for their work. And what they say is, first, we endorse the thrust of the comments received that travel for patients and carers will become extremely difficult, time-consuming and costly. This is a significant issue which can't be brushed aside. Secondly, they say, continuing to provide access to beds within the facility helps those with a short-term need who are then able to return quickly to their normal environment. And finally, we reject the impression given by the report that because majority of responses are from people local to the Wells area, this somehow unfairly biases the feedback against the proposal. On the contrary, since local people are disproportionately affected by the proposal, their voice should be given even more weight than those for whom the exercise is theoretical rather than real. And thank you for that response. I don't think anyone's suggesting that we shouldn't take full account of the people from the Wells area. And of course, we recognise that there are needs for facilities in the Wells area. It's something, as I say, as someone from Mendip myself, I'm constantly talking about in our governing body meetings. But we also need to take account of the health and safety of patients across the piece and make sure that everyone is concerned. So those are the sort of weighing of different aspects of the case that we will have to make when we come to our final decision. And we had another comment, this one's anonymous, saying that North Sedgemoor is closer to Weston-super-Mare than Wells. So that's I think as a contrary view, really, from as far as Sedgemoor is concerned. I come from the Frome area. I think we're about equidistant from Wells or Yeovil, certainly in travelling time. So yeah, it very much depends where you live in the county as to where the best position for a county-wide facility is likely to be. These are all the questions we're going to be discussing. We have to wait now for that case to be put to us. The governing body will then take a decision, but I hope it's better informed by today's session, by the consultation process that we've had, and I can promise you that we will listen very carefully to the points that have been made, and we will make sure that we do, as far as we can, the best for everybody in the county in providing future healthcare. I think it only remains really now for me to say a big thank you to everybody for participating. I know it can seem, I think it was Peter who said it was a very dry presentation. I don't agree. I think that we've had actually a very good consultation result, and it's been very interesting to hear what people have said. Thank you for participating. If you want to continue to put in any views, particularly about the process, because the consultation as such is finished, but certainly anything on the process or any further thoughts you have, please do contact us, and the ways of doing that are now up on the screen. I'll just leave it there for a second so that if you want to scribble down any of those addresses, you can. But that really concludes our business for this evening. I wish we could have been in person in Wells tonight rather than disembodied people on screens, but that wasn't to be. But I hope that we have at least been able to share a flavour of where we are on this consultation, what the key points are that members of the public and others have raised on the proposals, and we must now wait and see what the outcome is. Thank you very, very much indeed to all those who've participated. Good night.